Welcoming to our YouTube channel dedicated to providing you with the latest information and updates on medical breakthroughs and treatments. Today we turn our focus to a disease that has affected countless lives, mesothelioma. I am here to shed light on this challenging condition and the groundbreaking treatment options available. Mesothelioma, a rare and aggressive form of cancer, is primarily caused by exposure to asbestos fiber. These microscopic fibers, once inhaled or ingested, can become embedded in the proactive lining of lungs, abdomen, or heart, triggering the development of malignant cells over time. So let's go dive in it. Malignant mesothelioma is a disease in which malignant cancer cells form in the chest or abdomen lining. Malignant mesothelioma is a disease in which cells are found in the pleura, the thin layer of tissue that lines the chest cavity and covers the lungs, or the peritoneum, layer of tissue that lines of the abdomen and covers most of the organs in the abdomen. Malignant mesothelioma may form in the heart testicle, that is rare. Parts of the body in which you can see the lung and the peritoneum, heart, pleura, peritoneum, lining abdominal cavity, and testicles. Being absorbed or asbestos can affect the risk of malignant mesothelioma. Anything that increases your chance of getting disease is called a risk factor. Having a risk factor does not mean that you will get cancer. Not having risk factor does not mean that you will not get cancer. Talk to your doctor if you think you may be at risk. Most people with malignant mesothelioma have worked or lived in places where they inhaled or swallowed asbestos. After being exposed to asbestos, it usually takes a long time for malignant mesothelioma to form. Living with a person who works near asbestos is also a risk factor for malignant mesothelioma. Signs and symptoms of malignant mesothelioma include shortness of breath and pain under the rib. Sometimes the cancer fluid to collect in the chest or in the abdomen. Signs and symptoms may be caused by the fluid, malignant mesothelioma, or other conditions. Check with your doctor if you have any of the following: trouble breathing, cough, pain under the rib cage, pain or swelling in the abdomen, lumps in the abdomen, constipation, problem with blood clots, weight loss for unknown reason, feeling very tired. Tests that examine the inside of the chest and abdomen are used to diagnose malignant mesothelioma. Sometimes it is hard to tell the difference between malignant mesothelioma in the chest and the lung cancer. The following tests and procedures may be used to diagnose malignant mesothelioma in the chest or peritoneum. Physical exam and health history. An exam of the body to check general signs of the health, including checking for the signs of disease such as lumps or anything else that seem unusual. A history of patient's health habits, exposure to asbestos, and a past illness and treatments will also be taken. Chest X-ray. An X-ray of the organs and bones inside the chest. An X-ray is a type of energy beam that can go through the body and onto film, making a picture of areas inside the body. CT scan. A procedure that makes a series of detailed pictures of the chest and abdomen taken from the different angles. The pictures are made of the computer linked to an X-ray machine. A dye may be injected into a vein or swallowed to help the organs or tissue show up more clearly. The procedure is also called computed tomography, computerized tomography, or computerized axial tomography. Biopsy. The removal of cells or tissues can be pleural or peritoneum so that they can be viewed under the microscope pathologist to check for the signs of cancer. Procedures used to collect the cells or tissues include the following: fine needle aspiration, biopsy of the lung, the removal of tissues or fluid using a thin needle. An imaging procedure is used to look at the abdominal tissue or fluid in the lung. A small incision may be made of the skin where biopsy needle is inserted into the abnormal tissue or fluid as a sample is removed. Thoracoscopy. An incision is made between two ribs and the thoracoscope is like instrument with a light and lens for viewing and inserted into the chest. Thoracoscopy. An incision is made between the two ribs to check inside the chest for signs of disease. Peritoneoscopy. An incision is made in the abdominal wall and periscope. A thin tube-like instrument with a light and a lens for viewing is inserted into the abdomen. Open biopsy. A procedure in which incision is made through the skin to expose and remove tissues to check for signs of disease. The following tests may be done on the cell and tissues sample that are taken. Cytologic exam. An exam of cell under the microscope to check For anything abnormal for the mesothelioma fluid is taken for the chest for the abdomen. A pathologist checks the signs of the fluid and cancer immuno, immunohistochemistry. The laboratory test that has used antibiotics to check for the certain antigens in a sample of patient tissue. The antibiotics are usually linked to an enzyme or a fluorescent dye. After the antibiotics bind to a specific antigen in the tissue sample, the enzyme or dye is activated, and the antigen can be used to seen under the microscope. This type of test is used to help diagnose cancer and to help tell one type of cancer from another type of cancer. Electron microscopy. A laboratory test in which cells in a sample of tissue are viewed under the high-powered microscope to look for certain changes in the cell. An electron microscope shows tiny details better than other types of microscopes. Thank you for joining us on this important mission to spread knowledge, hope, and support. Remember to subscribe and hit the notification button so you don't miss any of our upcoming episodes dedicated to mesothelioma treatment. Stay strong, stay informed, and let's make a difference together. Thank you. Goodbye.